All right. Good morning. Good morning. Good morning. Good morning. Welcome to our healthcare professional brunch. Let me make sure. Let me check sound? Hold on one second. Uh, Good morning. Good morning. I'm checking, doing a sound check right quick. Jess, can you check my sound? Make sure I'm good. I see that I am live on all the platforms. We're good? Good on the sound. Great, 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 great. Good morning, good morning, good morning. Again, welcome. We're at our quarterly healthcare professional brunch. This is our second one. Um, we are excited, excited, excited. I'm getting ready to start doing some interviews. Jessica, let me get Jessica before we go live. I'm going to see, can we do a quick walkthrough? Um, let's see. We may have to do it after my first interview. Uh, let's see. Okay, Miss Gladys, come on back. Come on back. You can join us right over here and watch the chords as you enter into the studio. Have a seat here. All right, that's our camera. Okay. Let's get it centered so we can get both of us on here. I might have to come over a bit. Let's see. I think you're fine. I think I got it moved. All right. Good morning again. We're here at our quarterly healthcare professional brunch. We're going to be interviewing some of our attendees here. The whole purpose of this brunch, let me see, we need to be centered just a little bit more. Hey, hey. We got people coming in. Let's see. Hold on, Jessica. When we get a second, how can I bring you on so you can do the room on your phone? You know how we did that last time. Okay. All right. I'm gonna start on this interview though. But again, I am here with Miss Gladys Bussey from Source. I'm going to let her tell you all about her company and the services they provide and how they can help you. Again, this is Innovative Senior Solutions Quarterly Brunch. Just a little bit about who I am. I am Ishonda Blue. I am the CEO and co-founder of Innovative Senior Solutions. We are your number one choice for adult daycare services. We also provide structured family caregiving and other things as well, but our main thing is adult daycare. And today we're here at our quarterly healthcare professional brunch. We're going to do this every quarter. We see the need to collaborate. We see the need to network, and we see the need to make sure that we're networking so everybody can know about the services that they need. And if we're working together, we can better serve our communities. Yes. And so that is the purpose of our brunch. I am so excited. This is just our second one, but I see this thing being something hot. So yes. Very excited about it. Now, I have Miss Gladys Bussey here. Now, Miss Gladys, if you can tell them about Next Step Source and your where you guys are located, what you guys do, and just whatever you feel like the audience need to know on today.
Okay. My name is Gladys Bussey. I'm the administrator of Next Step Care in Albany. We cover every county in the state of Georgia. We have offices set up all over the state, and they cover so many counties in each office. And I cover about 13 counties in my office in Albany. And we are a Medicaid waiver program. Medicaid pays for the services. If a member needs help with their bathing, dressing, we even do meals. We have an aide to come in and help out with bathing and dressing and everything. And all this is paid for through Medicaid. We also have the emergency response system. We also assist with the ALSs, which is the alternative living services, which is a personal care home. In other words, they just put all those big letters behind it, but it's just simply a personal care home and adult day help. We also work with Jessica and with Innovative with that too as well.
Can I clarify for the audience? So you guys are case management.
Yes.
So if someone is looking to receive a caregiver through home care or attend adult day center or move into a personal care home, they first have to go through you guys.
Yes.
They have to go through the case management company and you guys get them. Let's just say they're not even on Medicaid. You guys can help them see if they're qualified, let them know what they're missing if they potentially get qualified. But the application starts with you guys.
Yes, yes, it starts with us, and there's several different types of Medicaid, and there's only a certain amount that we take as the source program. So the best thing to do would be to call in to one of our offices, and then we'll be able to look you up in the Medicaid waiver program web portal, and we'll be able to see what type of Medicaid that you have, and then we can tell you whether you qualify for the services.
Awesome. So listen, when people come to us for services, what we do is we like have a referral form that we fill out and we send it to them. And we send it to agencies like Next Step Stores to see if you guys qualify, or if you're already on the waiver and you may need let's just say you're on structured and you may want to use adult day respite. So you're already on the waiver. We can also talk to Next Step if they have you guys, and they can just refer them over to us. So I just wanted to point out that Next Step Source is a case management. They're kind of the umbrella
Yes.
to the community care services, and they cover all community care services. She said emergency response system, you name it, they do it, and they cover all of Georgia. But specifically 13 counties and all in
Around the Albany area.
around the Albany area. Yes.
And if you're not in one of those counties, I can always refer you to that administrator in that office, and she'll be able to help you out.
Okay. Now I'm going to try to type your phone number in the chat to your office while you tell them about this exciting news service you guys have here.
Okay, we have a new program. This it's a private program, and it's pilot right now. So what we're doing is trying to capture people. They don't have to have Medicaid. They don't have to have Medicare right now. There's no paying source right now for this one right here. We're just trying to capture members as they come out of the nursing home to make sure that all their needs are being met. They're keeping their doctor's appointments. They have medications when they get out of the nursing home. They also have transportation to get to their doctor's appointments and little items that they need around the house if they don't have it. Like we've been able to help out with wheelchairs, ramps, do little things around the house for the members, put little railings up to the doors and things that they need in the home. Even help out with wheelchairs. We also help out with any incontinence supplies that they might need as well. But right now it is a pilot program, so we're in the process of putting in all the things that we need in order to make the program exist.
Okay, so I just put your number in the chat here. So this program, what is the purpose of the program?
It's to make sure that members' needs that they don't drop through the cracks anyway, because they have these. We monitor their. We do disease management checks on them, and we make sure that they don't drop through the cracks. In other words, they're staying on track with keeping their doctor's appointments, making sure they're taking their medicines and all that. So helping them out if they need to transition to other agencies like hospice and things like that. Try to make the process easier for them. In other words, but some of them don't even know what they need to, how to start doing these things. I have one now that wants to transfer their loved one into a nursing home. They don't know what they need to do to do it. So we're helping them out with this process.
This is a much needed
Yes.
service. And this is probably going to blow up.
Yes.
Okay, so this is Next Step Care. I think I left Care out. Next Step Care Source, and their phone number is 888-762-2420, and their website is nextstepcare.org. I think I'll put that in the chat as well. Ms. Gladys, is there anything else you want to tell them while we're here live?
No, just reach out to us if you need any help, and we'll be glad to help your loved one.
So let me put this in here. Next website. Next Step Care.
Mhm.
All right, now we've been working with Miss Gladys Bussey for years.
Yes.
Miss Gladys, don't leave without me getting your calendar.
Okay, all right.
We
Thank
gotta
you.
get on her calendar.
Yes, yes.
Thank you for joining us on the green table, and thank you for telling our viewers about your services. Now they can put a face with the
Yes,
name.
yes.
They are very friendly people, and they're here to help and serve our communities.
Yes, we are.
All
Thank you.
right, thank you.
All right, then. Thank you.
All right.
Thank you.
You're welcome. All right, the green table is going to be hot today. Let's see who we're going to have next to come here on and share the chair with me to tell us about their services that they provide to our community. Listen, I am so excited. I cannot wait till I can show you everyone here at our quarterly brunch. This is just our second one, and we have a room full, and I'm excited about it. I'm ready for my next one. Okay. You can come right over here to my green chair at the green table.
One text.
Okay, come on. I'm ready. I'll get some water while I wait.
How are you? How are you doing, man?
I am good. How are you?
Fantastic. My name's Bruce.
Come on over. Hi, Bruce. Nice to meet
Bowl in
you.
the China store.
Okay, Bruce. I've never met you before. So tell me about your who you are and what do you do and your services that you provide in the community.
Well, nice to meet you. My name is Bruce Mattos. I work with Phoebe Putney Health System, and I lead the recruitment activities and initiatives for our health system here in the greater Albany area, including Americus, Sylvester, and some of our surrounding communities.
This is definitely a connection we need to make here on today. Tell us more about the recruitment and what does that mean in layman terms for the community.
So we do, our team does all the hiring for our health system. We employ about 5,000 people throughout our surrounding communities. And our team is responsible for going out and finding amazing people to come join our team and provide care for the people that need it. So we are a full hospital system and we provide top to bottom amazing healthcare for our community.
You do. I saw you guys were actually at the Capitol with your physician residencies. Was it last week or this week?
It was this week.
This week. Yeah. You want to talk a little bit about that?
So we are continuously advocating for changes in healthcare, growth in healthcare, and having residents at our campus. We get them through the University of Georgia. On the physician side, we get them through the University of Georgia. We get them through Morehouse. On the nursing side, multiple campuses in our region. That's the future of healthcare, is bringing in amazing young people. And we have to have our seat at the table at the Capitol to talk about initiatives, to talk about proper legislation and clearing roadblocks to get people hired, to get better pay, to get better protections, to get tort reforms, all those things. That's why we want to be at the table.
That's right. That's right. Okay. Anything that you want to let our listeners know on today?
So besides you come to us and we care for the community, that's what our role is. We love our community. We've been here 113 years. Our doors are always open. And if you want to be a part of that mission, if you want to come and help and serve, Phoebe is the place for you. We want to hire amazing people. And in order for us to care for our community, we have to fill jobs. So we're looking for the best, the brightest, but we're also looking for people that want to learn. We're looking for people that want to grow.
Yes, yes. Let me put some information in the chat. If you want me to put a website or a phone number, what would you like for me to put here?
So Phoebe, our careers, is back up. Nope, we got that one. Back up. All the way, keep going. We'll start with
Careers.
careers at phoebehealth.com.
And hold on.
PHOEB. OEB.
OE.
Yep. BE health.com.
I should have let you type.
No worries. Love your phone.
Okay, that's it.
Yes, ma'am.
All right. And what's your name?
My name is Bruce Matos, Mattos.
Yes.
Yes,
And
ma'am.
yes, your position is recruitment. Oh, spell check.
Gotta love spell check.
That's it.
Two T's.
Okay. And your position?
System director. Of talent acquisition.
Oh. All right. Thank you for coming and joining us here at the Green Table. Thank you for coming to our healthcare brunch. It's every quarter, so hopefully we'll see you again next quarter. And this is our way of building bridges as our community grows and need more caregiving capacity. And this is the way to do it by networking and collaborating. So
Absolutely.
thank you for joining us.
Thank you.
Yes.
You have a blessed day.
You too.
Thank you, everyone.
All right, that was Bruce. He is the systems director at Phoebe Health System, and he's trying to hire good people for Phoebe, just as we are hiring good people for Innovative. So we understand the caregiving need in our community. We need good people, and we need caregivers, we need nurses, they need physicians. They need nurse practitioners. They need it all. Yes, our community needs it all. All right, let's see who is going to be next at the green table. Let me see here. Invite guests to the studio. I was going to see how I can get my oh, I know what I need. I need the link. I need the link so that I can get on the studio. Let's see. I'm ready for my next guest. Come on in. Come over this way to my green chair at the green table. Let me get the link. Hold on.
Okay.
All right. Okay. Okay. Well, let you tell our audience about who you are, who you work for, what services you provide to the community. Just a reminder, the Green Table Senior Care Talk Show is about letting people know how to navigate through the senior care space.
Correct.
And we actually go live every Monday at 6 p.m. So every Monday, live at 6 p.m., we go live on all of our social media outlets. We're live on Facebook, LinkedIn, and I think we go live on YouTube as well, or we're housed on YouTube. But people can go back and watch. And again, this is a free service, so people can learn more about care and services
That are available.
in the senior care net, because you know it's a maze.
It is. And if you're not familiar with the contact or haven't had to utilize those services, then it is a bit difficult for those individuals. So that's why we're here.
That's why we're here. You know, we talk on this talk show a lot about how people don't plan for this. That's
No,
that's
they
part
do
of the
not.
problem. Like nobody kind of planned for it, and so when it happens, it kind of happens abruptly,
It
and
does.
it's really life changing
It
to those
is.
families.
Definitely.
And we're just here. We're here to be a sounding board. We're here to help navigate those
Yes.
waters. We're here to provide resources. And so, so go ahead and tell them about who you are and what you do in your company.
Yes. So I'm Renee Wiggins. I work with Montezuma Health and Rehab. We do offer services just like any other skilled nursing facility in the area, but we do offer long-term care services. So if you have a family member, friend, or loved one in the home and they're needing long-term care, maybe the services that are needed at the time are not where you're able to provide them as a caregiver, we offer those services. We also offer short-term rehab. So if you have individuals that may have, for an example, something they have maybe a broken hip or something. They've been to the hospital and they may need rehab, aggressive rehab. Maybe the rehab in the home is not enough, so they can come to us. We have physical therapy, occupational therapy, speech therapy as well.
Question,
Yes.
your short term,
Mhm.
now that's overnight stay, or
It
can
is.
they drop in?
It is overnight stay. We don't have outpatient. You're right.
Okay.
Some skilled nursing facilities do offer outpatient rehab, but at our facility we don't. But there are some in the area that may. So you can always, if you have questions about outpatient rehab, maybe we can give you a list of those individuals in the area that can offer those services.
I want to touch on this just a little bit
Okay,
because I think
okay.
this is where this could be very, very helpful, because usually what happens is mom or dad falls and maybe break a hip, or mom or dad has a stroke. But something happens where they need some rehab to get
Correct.
back to where they are. And that is what you guys offer in your short-term rehab.
Yes.
Okay.
Correct.
Just wanted to clarify.
Yes. And so it could be anything. It could be that, they suffered a stroke. It could be also sometimes, they offer those, if they're in the hospital and they offer those services in the hospital, but once they're done, they may have come from a swing bed in the hospital. And a lot of families don't know that after that swing bed stay, you can come to us to continue that rehab.
How many days is swing bed, and then how many days could they get with you if they left the swing bed?
Okay, so it just depends on the insurance that you have. So, like for example, your traditional Medicare may give you 100 days total that you have available for rehab.
Okay.
So, say for example, you were in the hospital and then you went to a swing bed for maybe 20 days. So the remaining of the 100 days is what you can still use when you come to us. So that is an option as well. And then if you have a managed care plan, it works a little bit differently. You have to have authorization, but that's still an option. So if you're at a swing bed and you have used days there, you can still come to us. It's just that those days have to be authorized by that plan, and which is basically getting permission from that insurance company to come to us.
So let's clarify. This is very good information. So usually rehab is 100 days.
Correct. Usually.
And this is Medicare.
That's Medicare, and most of the managed care plans mimic Medicare, which means they are supposed to follow the same rules as your traditional Medicare. So typically it's 100 days.
Okay. So if something happens to mom or dad and they need some type of rehab care, you get 100 days and Medicare pays for it.
Yes, but it's important to remember that you have to meet criteria medically. So if there's a need, so we want to just make sure we clarify, even though you may have 100 days available, it has to be medically necessary that you're still needing those services. So as long as you're progressing, and it shows in the documentation that you can benefit from those additional days, then yes, those days are made available.
That is very good information. Okay. All right. Keep going.
Okay.
Good.
And then the other is respite care. So respite care could be through a hospice provider, or it could be private pay. So for example, you have a loved one at home that you're caring for, and they're needing, say, the caregiver is out of town or needing to be out of town for, say, a work. Maybe their job is requiring them to go out of town, or maybe they just need a break.
Yeah.
Which happens often. So we are able to have that individual come. If you're coming through hospice, hospice will pay for a 5-day respite stay once a month. Okay? Yeah. So if you're on hospice, your hospice provider can contact us. They'll send us a referral. And like I said, that organization, that hospice provider will pay for a 5-day stay. The other thing is you can come via private pay. So if you're not on hospice, same thing, you're needing a break or what have you, then of course you can pay privately, and it would be our daily rate that you would pay for however many days that you're needing that individual to come and stay with us.
That is pretty good information. I'm gonna see can listen. I've been trying to type people names and stuff in here. I'm gonna let you type it. Let me see if we put your information. Hold on 1 second.
That's fine. And it's simple. It's Renee. I have Rochelle on my badge, but I go by Renee, which is Renee.
Hold on 1 second.
That's
Let me
fine.
pull it up. But I want to talk about how we can work together.
Definitely.
Get to.
Okay.
Let's get this information in here. Okay. All right. If you can type it in there. It's got a lag on it. But yeah, type your name, the name of your company, your name and your position, and contact number and email, website.
Okay. And we're with Montezuma Health and Rehab.
Okay.
And I didn't bring my glasses. But we're gonna we're gonna make it work.
I gotta have them. I gotta have them
My
on.
glasses.
When we get through
Okay.
that, we're gonna talk about how we can partner and work together.
Definitely.
This is what networking is all about.
It is, and that's why we're here. That is
Because
definitely.
I didn't realize y'all had subacute.
Yes.
So
Yes.
that was good information to know. And I didn't know y'all had respite care
Yes.
specifically through hospital.
Yes, ma'am.
So that was very good information
And
today.
we do have a Venice hospice that we use, but if you're with another hospice and you need respite care, not a problem.
Got it. Got it. Well, that was good information. And
I'm sorry.
I should get that right.
That should be an I.
Okay. You should be able to hit right there.
Yeah. Okay, there
Let me
we
see.
go.
Can I put it up? Let's see.
Okay.
Let's get the R out. And then right here. Is that right?
Yes, and then my email address. So that should be an I after the G. Right here. Not in the email address. So Sarah Wiggins at healthicahealth.org.
Health and rehab.
And then the email address is rwiggins at ethicahealth.org.
Does that look good?
That's it.
All right. You want to put a phone number?
That's fine.
Okay. Put a phone number. 478. One. Got it. All right. I got us in there. We're up. We loaded. So listen, I want to talk about how we can work together. So we are your number one provider for adult daycare. And we have a facility closest to you would be America's. We also have one in Columbus, but closest to you would be America's.
Okay.
And we also provide respite.
Okay.
We also, one of the things I like to say about adult daycare, which is why we chose it, because we've done home care, we've done personal care homes, we've done it all.
Definitely.
But we chose adult day to be the main thing is because you're never going to come to the center and say we're closed because of staff. And we provide the same things that home care do. So if someone is having challenges with home care, their caregivers are out, not showing up, or we can work with them, right? We can work in conjunction with them.
Yes.
But the main thing is, we can provide that respite care, which is a big deal now because there are so many family caregivers. I'm sorry, I don't have the statistic today, but that number is huge.
It is.
The number of family members that are taking care of their loved ones. And a lot of people don't know that the Adult Day Center is a healthcare facility. So there's a nurse there, there's caregivers there. I like to say that it is the main reason how the day center's really main focus or main purpose is to keep seniors in their homes longer.
Definitely.
And most people, when they say, I don't want to come to the center, because, they feel like they're being taken away from home, but really, we're keeping them in their home longer because that nurse is able to make sure they get their medicines,
Mhm, mhm.
identify changes in conditions earlier, and make sure they get the care that they need so they can stay home
Correct.
longer. So just know if you have someone that's discharged from subacute
Mhm, mhm.
care and you feel like they need a little bit more care to be safe at home, to stay home longer, that's where we can work with you guys and provide, see if they can come to the center and provide that assistance. for them.
And you're exactly right, because our social worker there, Ms. Jametta Nichols, she's very good as far as working with those individuals once it's time for them to return home. And you're exactly right. We assist with making sure that those services in homes, such as rehab, if it's if the need is there for ongoing, as well as any equipment. And so some of the times you're right, even though they're going home with family members, caregivers, some of them are still working and they may need that. Like you said, adult day help, an option to go to adult day help while individuals are out working. And you have those extra eyes that can,
And you go back home
and you go back home
and you
every
get a
day.
healthy meal every day.
Yes,
And we're
yes.
there every day. We're not going to not be open because of staffing. We have,
Mhm, mhm.
our staffing is, we have very little turnover.
And
Because-
that's important because in this industry it is so it has been of course we all know from COVID
yeah,
that it's an issue
Yeah.
with maintaining your staff, so that is that's great that you can hold on to your staff members and they show up every day, so that is
Yes,
awesome.
Listen, I want to schedule a meeting.
Yes.
So before you guys leave today,
Okay.
let's get on the calendar and we'll come to you guys this time.
Awesome.
And I would love to meet your discharge planner. Let's meet your
Yes.
team,
Mhm.
meet our team,
Okay.
and let's work together.
Awesome. Thank you so much for
You're
your time.
welcome.
We
Thank you for
appreciate
coming
it.
to the green table.
Anytime.
Yes. See, we always learn something new. This is why it's important to network.
Definitely. That's
Yes.
why
We're tearing down wall and we're building bridges to be able to work with our community. Yes.
Thank you so much for having us.
Oh, thank you. All right. I'll see you before you leave. All right. Thank you. All right. Let's see who's going to be up next on the green table. Y'all have to excuse my typing skills over here is not good, but we're going to work it out anyway. Again, thank you guys. We're here at the green table. Hey, come on, my friend. We're at our quarterly healthcare brunch. I have a friend just made it to the show here. She's here at the quarterly brunch. Hey, you're not a stranger to the green table.
Of course not.
But tell them who you are and the name of
All
your
right.
company and the services that you provide.
I am Earlene Bacon, and I'm an expert in health insurance, Medicare, and health insurance for those that are non-Medicare eligible, as well as life insurance. And I've translated those expertise into real estate
Yes.
over the last year.
She's
so.
selling. She know how to sell. Listen, I need her on my team. Now you said something interesting. You said non-eligible
Mhm.
Medicare. Break that
Mhm.
down. What does that mean?
So a lot of people, they don't understand how health insurance for those that don't have Medicare works, and if they don't qualify for Medicaid, state Medicaid. There are plans through the marketplace that people can qualify for that are non-Medicare eligible. So because sometimes people think that Medicare is only for people that are older, but some people that are on disability, if they've been on disability for 24 months or longer, usually they're eligible for Medicare. A lot of people don't know that.
We learning something today.
And those same younger people are entitled to the same benefits that the older people get. As long as they have that red, white, and blue card, then they're eligible for all that
Girl,
extra stuff.
Go ahead and break down the cards for the viewers. Listen, I learned from her about
Yeah.
Medicare, Medicaid, and the different plans.
Yes.
Can you give them just a little short
Yeah.
breakdown of
Okay.
the difference in the different types of
Mhm.
Medicare, Medicaid, and who is for, and
Mhm.
we know the colors of the cards, but we don't know how to use them. We're gonna learn today.
I got you. So what I generally tell people is Medicaid is aid from the state. So think Medicaid, aid from the state.
Okay.
Medicare is federal. Okay. And again, that's that red, white, and blue card.
Okay.
Okay.
Red, white, and
Because
blue
usually
card.
that's what people, when you say red, white, and blue card, they know what you're talking about. But the government offers parts A and B, the federal government. And people that usually work at least 40 quarter hours have earned to get part A, which is the hospital and inpatient services at no cost. Okay.
So I just had a young lady on that did subacute care
Mm-hmm.
in the nursing home,
Okay.
like rehab.
Okay.
So that would be them.
That is correct. That's
Mhm.
inpatient, anything dealing with inpatient.
Got it.
Part B is for anything outpatient and doctor services. Okay. And that always has a premium, no matter if they work long enough or not. And this year they're paying $180 for it a month.
Mhm.
Yes, ma'am, $185. And most people can qualify for the state to help them pay for it if their income is low enough. I always tell people apply, tell the truth, okay, about your income and assets, because they will find out. All right.
They don't play.
They do not play. You may get it for a couple of years and they come back and say, well, we found something. And if they deem it to be yours, you will be paying back every dime that they pay for you. So please be honest, y'all. I tell people all the time, it's not worth it getting that help and then having to pay it all back, because they will garnish your Social Security check.
Oh.
Okay.
You have been warned.
Right. That serve as your warning, to be honest. Okay.
Yes.
So, but those two things entitle people to extra benefits that the government partners with insurance companies to offer Medicare Advantage. So you get the traditional Medicare, the red, white, and blue card. Then you have Medicare Advantage through the private insurance companies. So that's in a sense privatizing Medicare, and that's when that's part C and D.
Break down what privatizing means.
Okay, that means that they've contracted with the Medicare government. The government has contracted with the insurance companies to facilitate the Medicare benefits. So instead of Medicare and the government paying the bill, the insurance companies then pay the bill. So all they do is then give them an allowance. So it saves them money, because you have to remember, that's just like with programs, Fannie Mae and USDA, those are government-backed programs.
Right.
But they're not the ones that are actually doing the, everything, the lending and things of that nature.
Right.
It's the same way with Medicare. So that's what I try to help people understand it that way.
Okay.
So, and generally, they have to cover everything that the government would have covered with that red, white, and blue card. Bare minimum. That's what they have to give them. But usually, to be competitive, they give them those extra benefits, those allowances, the food cards that everybody talk about, those type of things.
Talk about the allowances. Like some people may not even know.
Yeah. So the people that get the most are those that have both Medicare and Medicaid. So they have that red, white, and blue card, and they're getting the aid from the state. Okay.
Yeah, both
cards. They're called dual eligible. So that's why it's called dual, because they got the two cards. Okay. So those people usually get the richest benefits. So usually they're going to get transportation. They're going to get a card to be able to utilize for grocery, over the counter items, pay for gas. Sometimes they help pay for utilities. So, it's a lot of benefits that they don't get if they just stick with the original Medicare and Medicaid.
Wow.
Yes.
This is good. I'm going to have to get her back to the green table so we can dig into this again. There are renewal periods. You want to talk about that?
Yes. Right now we're in what's called the OEP, the open enrollment period. During this period, even if they made a change during the AEP, which is the annual enrollment period, which started October 15th and went through December the 7th, they can still make one change. Okay. And if they miss their change in the AEP, they can still make a change. But if they have a chronic condition, or if they do have Medicare, Medicaid. they can make one change. And that deadline ends March 31st. So
Okay.
after March, everybody's locked in. Whatever you got is what you're going to pay for the rest of the year.
Okay.
Okay.
Okay. So I'm gonna let you type your name and
Okay.
information here
Okay.
in the chat. And then if it's one thing, anything else that you want to leave the audience with before we finish with, I'm gonna let you put that in there first.
Okay.
Um,
I would just say, make sure. Let me say this because I get so many calls. Usually in August when they start letting us know what the plans are going to be, I start studying these plans so I can see what's going to be the best fit for each of my clients. Right. Sometimes people they get to talking to the friends, and the friends go to talking about what they got.
what they got.
Everybody is not entitled to the same benefits. Okay, some people can get the richer benefits because they do have the low income that qualifies them for those extra cards, like the Medicaid card. Okay. But then if you got income that is high and above the poverty level, you're not going to get all that stuff that they get. Okay. So just know that everybody don't always tell you everything. Okay.
Okay.
And so they
So
may
go to the source.
go to the source and see what you're eligible for, and don't get tricked and scammed by phone calls because they give you the moon and a few stars. You understand what I'm saying on their phone, but then when at the end of the day, it's not gonna be what you think it's gonna be because everybody isn't eligible for all those benefits that are being advertised about on the television. They just trying to get you to call in.
Can I add to this? So I just thought of a question
Okay.
too. But listen, it's important to get because it's a lot of providers out there.
Yes.
And so it's important to get with you a trusted provider.
Right.
Get with you one trusted provider,
Yes.
someone you trust, and they will keep you in line. And like she said, you want to be cautious because there's so many what's the word I want to use? Scammers and unethical scammers and unethical people out there that may just be want to get you to change just for this, and and you get over there and you're not taken care of, right? So I just want to stress to get with the trusted provider. This is a trusted provider, and that's important.
Yeah, in March it'll be 26 years that I've been doing this.
Wow.
And the government made a lot of changes for 2025 that a lot of people were unaware of. Now, I even explained it to all my clients, all my Medicare clients, but even they forgot when January came in and they went to the pharmacy. One of the major things, I do want to say this, one last thing, they got rid of the coverage gap for the prescription plan. So there's no more donut hole. That's what they used to call it. Their nickname was donut hole.
What does that mean?
That meant that once they reached a certain number of total out-of-pocket costs, so it was not only what they paid in a copay, but it was also what the insurance company paid. That amount combined would get them to a certain amount, and then they would be on their own with paying for the medication. Well, that is no longer. But because of that change that Medicare made, the insurance companies, of course, had to get on board and kind of get things set up to where they wouldn't be out of business. Because now the way it works is once a Medicare beneficiary hits $2,000 of total out-of-pocket costs, they don't have any more out of pocket for their prescription drugs. So it's like totally different now. But because of that, there's more upfront costs. So January, I'm sure a lot of people have been like mind blown when they went to the pharmacy.
What's going on here?
Yes, and because everybody's calling me, I wasn't paying this much last year. And I was like, that's what I kept telling y'all. Things are changing. So in January, the majority of companies are charging a deductible up front. And those deductibles are not little deductibles. Okay. I've seen deductibles as high as $590.
Oh, wow.
Yes. So that is going to affect a lot of people. But there are programs. They did put programs in place, but you have to apply for them through whoever your insurance carrier is. You have to apply for those programs to help you finance those out-of-pocket costs. And they kind of spread it out over the year instead of you having to pay it in one lump sum.
Right.
So just Yeah.
That right there.
It's
So
a
that's a
lot.
change. So
Mhm.
she said things are changing, which is my next question.
Mhm.
Things are changing.
Mhm.
Do you, in light of these, with the new administration,
Mm.
do you see changes, or
Yes.
how's that going to affect
Yes.
Medicare, Medicaid, or Advantage plans, or any of this?
So from what I understand, he has already undone that change that was supposed to help them from having to go into that coverage gap and be on their own. That's already been undone. So that's how it's going to be for this year, 2025. But 2026, more than likely, we're going to be looking at a gap again. So people really are going to have to utilize um, pharmaceutical savings programs, things of that nature. Help get their doctors to help them get these things set up. Ask the pharmacy. If you don't ask, they're not going to just tell you, because they're not going to know that you're having these issues. You know what I'm saying?
Right.
So I always tell my clients, utilize samples. Number one, because a doctor does get samples brought into the office by these pharmaceutical reps. So utilize samples as long as you can. And then once those samples run out, then get connected to these pharmaceutical savings programs that usually you may not even have to pay for medication, because it's directly from the maker of the drug. So you'll either not have to pay, or you'll have a very deep discount. So those things will help you, with your medication costs. And even if the gap does come back, it helps you stay away from that gap.
Okay, I got to bring you back on.
Okay.
I'm going to bring her back to the green table. We won't be live this Monday. Okay. I'm going to get with her and see what we can come together on a Monday, so we can talk about these changes.
Yes.
But most importantly, how to be prepared for these changes and things that you can do to save costs.
Yes.
Let's do that.
Yes, that sounds good.
Okay. She'll be back.
Yes.
All right. Thank you for coming.
Yes, ma'am. Love you too.
Yes, we got to get her back, because we got to be educated, right? These changes, we can't stop these changes that's coming, but we can be prepared. So we're going to bring her back definitely, so we can talk more about that. All right, let's see who's next on the green table. Let's see. Listen, we've already had some great guests here tonight. This is not even, the room is full over there. So I know I'm not going to be able to get all the guests, but these are people that I can definitely bring back at another time on the green table, when we actually are live on Mondays to talk more about their services. But so far this morning, we have had Next Step Care. From Albany, Georgia, who is a case management company for community care services. We've had Bruce Matos, I think I'm saying his name right. He's the system director of talent acquisition at Phoebe in Albany. We've had Renee Wiggins of Montezuma Health and Rehab, and she talked about their subacute services and their respite through hospice. We just had Earlene Bacon from Bacon Insurance and Financial and Real Estate, who talked about some of the changes with Medicare and Medicaid, but specifically with these prescription changes. And we're going to definitely get her back. So yes, we have had some great people here on the green table. Let's see who else can we get on the green table. I'm going to go over to the conference room and let me see, can I get someone else? You guys hold tight. All right, I'm back. I had to go round up someone else to come to the table. Jessica was so busy in there with the attendees. So yes, so tell the green table. Welcome, first of all,
Thank you.
to the
Thank
green
you.
table. Welcome to our quarterly healthcare brunch.
Yes.
Can you tell our viewers about your services and who you are and whatever it is that you want them to know?
Okay. My name is Brother Clad, and I live here in Americus, Georgia, with my husband, Ricky Clad, and we have two children. But my services are that the name of my business is Breath for Life.
Breath for life.
Breath for Life, and that name means a lot to me. I chose that name simply because when I thought about what could I name a business for CPR and AED and first aid use, how can I train? What would be the name that'd be perfect for that? What I thought about was that Jesus Christ, He gave His life, His breath for my life.
Mm.
So I said, that's perfect for me to train an individual how to give their breath to save someone else's life.
I love it.
And so that's how I came up with the name. So that's what I do. I will certify or recertify you in first aid, AED, CPR. I do basic life support because I am a basic life support instructor, certified by the American Heart Association.
Mm.
And I will train an individual on Heart Saver or BLS, basic life support. So whether certification or recertification, or just to get the education. It might be something that not necessarily you want your certification, but you just want to be educated on how to properly do CPR.
Let me ask you this, because there's family caregivers are like it's a large population
Mhm.
now. It's actually what we need to expand our caregiving capacity
Right.
in our communities, because it's just not going to be enough workers to do it. So
Right.
a lot of family members are doing it.
Mhm.
Do you train family members?
Absolutely.
Okay.
Absolutely. I train family members because, like I say, it might not be that you want certification. You just want the education. You want to know how to properly do CPR, or how to properly administer an EpiPen, or
that part.
yes, or how to properly bandage a wound or stop bleeding. So those are those type things that individuals might just want to know just to be in their home, just being their own. How do I do this? What are the signs of how to prevent someone from choking? What are the choking signs? What are the signs when when you want to know that a person needs CPR or they actually need the use of an AED? So they want to know the signs between a heart attack and cardiac arrest. They might want to know the signs because there is a difference between the two. And so it's good for, I think, for all of us to know those things. Just to be educated. But yes, ma'am, I will.
So there are a lot of companies out there. Well, they're not a lot, but there are quite a few. I want you to connect with Miss Gladys Bussey. Hopefully, everybody got your card in there, right?
Not everybody.
Oh, they should. They should have the card.
Not everybody.
And I got your card, and we'll definitely be calling Breath for Life as well, because I believe in training our team. Training is important to us, and we want to make sure that they have, and we are required by the state actually to make sure our people are trained in CPR, first aid. But Miss Gladys is a case management company, Next Step Care.
Okay.
And there are different ones out there. But the reason I want to connect you with her, because she can tell you the other companies that hire family caregivers.
Okay.
And those people also are supposed to be trained.
Okay.
I don't know if it's required by the state, but it is strongly recommended. And that would be a great network for you and for them too.
I would love
meet
that.
her before she leaves. Okay, now I want you to put your information here. If you don't mind typing it in, you can either use the pen. I want you to put your name, the name of your company, contact number,
Okay.
website, if you have anything that you want them to know.
Okay.
I want it to be able to go into the news feed.
Okay. Absolutely.
Yes. And this is how we network. Listen, I
I
am
love
on
it.
building these bridges. I'm telling you, I'm going to be bringing people in and we're going to talk about their company, but also how do we network and work together? How do we work together? That is so
This
important.
is so wonderful. Very wonderful.
Yes. Let's see. She's putting her information in. I'm going to get me a water break. I just text to see how long we're gonna be able to be live. I know we're supposed to be done at 1:00, but time is going by fast. It's going by fast. Breath of life, CPR, first aid, training. But she mentioned some other things. I'm gonna let her talk about those a little bit more about the EpiPen and other things that you need to be able to do in the home that can save a life. Right?
Yeah, right. Absolutely. Number reset. Phone number.
Phone number.
I don't never remember the business number.
I'm the same way. I'm glad I'm not the only
I
one.
don't remember the business number.
I'm gonna look at Jessica.
Anything else?
Is that good?
Is that
All right,
good?
I'm gonna hit send.
Okay.
You're in there.
All right, thank you.
All right, now tell them again. I know you said CPR first aid.
Mhm.
I think people are familiar with that, but what are some other things, life-saving things that they can be trained on that can make a difference in the home?
Okay. Choking. An individual can be choking, and so those are some things that we teach people how to help someone who's choking. To get that large from them, whatever object it is, the proper way to do it, and because you don't want to do nothing that cause it to be worse.
That's right.
Okay.
That's right. That is good.
So the proper way of doing that, I teach that as well. And also we have individuals who have certain allergies, and they might be allergic to something and have a allergic attack. And if they have the availability of an EpiPen, they might can't use it themselves, but you can know how to use it on them, and that could save their life. They can save their life, and so I teach those things too. You might be out with your children or a family member or anyone, and they get stung by a bee or anything like that, and they might be allergic to it, or they might break a bone. And so I teach that as how to splint and how to help them until you can get and what the proper procedures, who you call, what do you do, and at the times, even and this is for I do it for infants, children, and adults. Okay, and even if you're got an individual and you need to stop a bleed, the proper use of how to do the bandages, how to stop that bleed, what to do, how do you bandage that, how do you stop that bleed, or if you just have a tear some cloth, what do you need to do to stop that bleed? So those are some of the extra things that we do.
This is so good. And let me tell y'all. So probably about a year ago, me and Jessica was eating lunch at Olive Garden in Columbus. I like to eat, y'all. But anyway, we
Me
were
too.
eating lunch, and I was on a business call, and I saw Jessica get up, but I didn't really, I was on this call.
Uh-huh.
But when she came back to the table, she said, "You didn't see me over there?" I said, "Oh." She said, "This guy was choking." And it was an elderly man who was with his wife, and because she knew what to do, it saved his life. And so it's just so important to, like I said, don't take that for granted.
Don't take it for granted because it's so needed. You never know, just like in your situation, you never know where you are and what situation that you will be in and will need those services.
That's right.
For anybody. And it's just those those instincts that kick in when you know these things, when you're trained on these things, those instincts,
It'll kick right
it kicks
in.
right on
That's
in,
right.
and you
That's
go right on and do what you got to do to help that person.
That's right. That's why that continuous
Continuous training.
yes,
Mhm,
it's important.
mhm.
It's important.
It's very important.
Well, listen, I want to make sure you get your card out in that room in there because it's a room full of providers, and I'm sure all they people need CPR
This has
training.
been wonderful. I have enjoyed every bit of it. It's just, I'm so glad that I made the choice to come
I'm so glad you came.
and got to meet you all. You know, because this is wonderful. I'm looking forward to more. I'm really
I want you to
am.
come every time.
I want to. I want to come every
Yes.
time. I want to come to every time, and so, and I even want to attend y'all fall event. I hear that y'all having a fall event.
Oh, we're getting ready to start promotion on our senior festival, and we want you there.
I want to be
We
there.
want you
Yeah, I
there,
want to
so.
be there. I want to
Yes.
be there. Yes.
So
This is
we
wonderful.
give us a month,
Okay.
and
Gotcha.
we're gonna start sending out so vendors can start registering, and we're gonna be in a new place. I'm so excited about that. We're gonna have to definitely go live.
That
and talk
sounds
about that.
wonderful. Yes,
Yeah,
yes,
yeah.
that sounds wonderful. And I didn't mention, but I do also train on the use of AED. I didn't
Tell them
mention
about
that.
AED. What is
Yes,
AED?
AED, the use of AED. And that's all. Some places have the AED machines in there,
Like
but
Walmart.
like Walmart, yes. And if you know how to properly put those pads on, where to put them pads to get that rhythm of that heartbeat, because that's what's wrong with the patient is that heartbeat rhythm gets off.
Mm-hmm. It
You
needs
know,
the shot.
It needs that shock to
Mhm.
get that rhythm back on. So I train on that, on properly using a AED, how to use it and how to actually, because the AED machine actually tells you everything to do.
Yeah.
And so, but when you're trained on the listen to what it's telling you to do and know exactly when to administer that shock, that's what I train on, how to actually use the AED machine. And like she said, you can be in Walmart, and then if someone go into cardiac arrest and that rhythm they got off, and you can use that AED machine. Other individuals might not even know how to use it. The machine is there, but with the machine's there and they don't know how to use it, don't benefit. Right, they're using it. But it's all about getting that heart back on rhythm.
Yeah. Yeah, that's awesome. That's another way to save lives. So,
Yeah.
listen, this is not just for healthcare professionals. This is for family caregivers as well. If you're taking care of a loved one, you need to get trained in CPR, first aid, and these things can definitely save lives. So,
Absolutely.
thank you for coming to the green table.
Thank you for offering the green table to me. I feel honored.
Thank you. And we're going to see you hopefully back next quarter.
Yes.
And at the senior festival.
Yes.
I'm gonna go ahead and drop the date. It's September the 10th. I was gonna try to hold it.
Okay, you can hold it. I'm sorry, I pushed that.
But the senior festival is gonna be September the 10th, and we're in a new location. We're gonna be at Georgia Southwestern Storm Dome. So we are excited about that. We tried to stretch South Georgia Tech as long as we could because we love over there. They gave us great support and great service. But we just got grown with it, and that's okay. That is okay. That's okay. So I'm looking forward to that as well. Yes. Thank you so much. Thank you. All right, y'all. Well, let's see who else I can get on the green table. I think, let's see, we got about a good 30 minutes left. So let me go find someone else. Come on, we'll go out and see, can we get someone else on the table?
This is beautiful. This is wonderful. Out there. No. All right. Well, I just got permission to wrap it up. We have had a great day here at
our quarterly healthcare brunch where we are working to build bridges to collaborate with our community healthcare partners. We had a great turnout on today. I'm gonna see, uh, I was gonna see, can I bring the camera? I don't know if I can do that. Let me not do that. That'll be too much. Listen, I wanted you guys to see everyone in the conference room here. But anyway, take my word for it. You want to be at the next one. And let me see if I have the date. Hold on. For the next quarterly collaboration. Oh, I got it. It is May 16th. Is that right? May 16th is the next quarterly healthcare brunch. And so we'll definitely get promotion out on that so people can start to register. You don't want to miss this event. I've seen people here connecting, working together, um, and it's changing things. It's definitely changing things. And hopefully, this is something that can help our community so we can be better providers to our community. It's enough out here for all of us. We got to work together. We got to work together. So listen, thank you guys for joining us here at the Green Table. We will see you again, as I said, on May 16th at the quarterly healthcare brunch. And again, the Green Table now is every Monday at 6 p.m. We are live here on social media, but we would not be here this Monday because we had an event out of town. But other than that, we'll be here on Mondays. Thank you guys for joining us. See y'all soon. See you later. Oh, I didn't get your information. Let me get out of here. Trying to